Of course, the senator being diagnosed yesterday with a malignant brain tumor, one that they say is inoperable. They say radiation and chemotherapy are the only cures. But what are his chances of survival, and how long might the good senator have? Joining us now is Dr. Jake Deutsch of Hackensack University Medical Center in New Jersey. Good morning, doctor.
Hi, Megan. How are you?
I'm well, thanks. It's interesting because we got a lot of email yesterday from people who don't like Senator Ted Kennedy, but who said nonetheless, they're rooting for him. Something like this, a lot of people have dealt with cancer, and it is somewhat encouraging to see him getting out, going back to his home, participating in all the events he always participates in. Is this realistic? How long, given this diagnosis, can he keep that up?
Well, this is about as devastating as a diagnosis as one can receive. So to make an accurate prediction is difficult, but what the statistics show us is the 5-year survival for somebody of his age category is about only 5%. So it is a very grim diagnosis indeed. From also what we're hearing, it's not going to be surgically treated primarily, which is usually the mainstay or the first line of treatment in order to reduce the size of the tumor. And that also gives some indication that this is a pretty serious diagnosis, an aggressive tumor, something that's going to be difficult to isolate in surgical treatment. So those are indicators that I'm perceiving that let me know that this is going to be a very difficult course for him.
And what about, and by the way, we just got word that his departure will be momentarily, so we're on this. What about his duties in the Senate, Dr. Deutsch? Is it possible, would the tumor or the treatment of it interfere with his ability to continue on in his role as a United States Senator?
Absolutely. I mean, I think that the indication of having a seizure just recently is one sign. You're talking about the parietal lobe, which is the part of the brain that affects speech and communication. So that certainly would be a factor. And if there's any further motor function, so there could actually be problems with the way you move and get around, I think it's going to be quite seriously, debilitating.
And how, it was a pleasure to see that picture of Senator Kennedy with his family, all smiles yesterday. And of course, that's the way we'd like it to remain, But
Right.
But what is the realistic expectation over the next year for him?
Well, realistically, I anticipate pretty aggressive treatment, and that would include radiation and chemotherapy. Radiation is very powerful, basically X-rays that will be used in order to try to shrink the tumor. Chemotherapy are powerful intravenous drugs that will be used to also help treat this cause. So these are very tolling on the body, especially when you're over 65. I imagine that he's going to need some serious time to recuperate and time set aside in order to let his body heal. So I anticipate a very rough course.
Is it all about the chemo and the radiation, since you can't remove this tumor? Is it all about extending life from 1 year to 5 years? Do I have the sort of over-under on the expectation there?
Yeah, really the radiation is the key, and that's in order to sometimes it allows people to live much longer. Sometimes it's enough to just shrink the tumor and have a better outcome. So that's the primary modality. The chemotherapy is more for the pain control. So as the tumor is being shrunk, it's actually very painful to destroy the cells. So the chemotherapy is going to be important along that aspect.
Ben, before I let you go, we had lots of folks on our air yesterday, and Senator Arlen Specter was one of them, talking about how they'd been diagnosed with brain cancer, brain tumor. They got a second opinion, they got better news, or
Right.
they lived to tell about it. Do you think there's any chance of that happening here, from what you know?
Well, I mean, I trained in Massachusetts. I could tell you that he's getting the best medical care that there is available at Mass General. There are certain circumstances, different types of brain tumor. There's over 120 different categories. So each circumstance is different. So to expect that in this case is pretty unlikely. But, you can only hope for the best. And certainly, my prayers and my warm thoughts go out to the senator.
Indeed. And you saw just such an outpouring of support on both sides of the aisle for Senator Kennedy yesterday.
Right.
Senator Byrd actually breaking down in tears on the Senate floor, talking about how much he loved him. Senator John McCain calling him a lion of the Senate. And we expect his departure momentarily. Dr. Jake Deutsch, thanks so much for being here with your expertise on it.
Thank you for having me.
All right. In the meantime, 10 minutes past.